Hi guys, this is Nick Gerthoffer, PTA at Atlantic Physical Therapy, and I'm going to talk to you today about doing some foam rolling to help work on some sciatica or lower back pain. Obviously we're using masks because I'm in the clinic right now, but I'm going to go ahead and take it off because we're not having anyone back in this area, so I'm going to be able to hear me a little bit better. Alright, so what I have is a foam roller here. It's a high density foam roller, so it's very firm. You can use ones that are a little more squishy that won't be as uncomfortable. And what we're going to do is we're going to work on rolling out this glute muscle, our piriformis, and just the back of our hip to help deal with, like I said, sciatic pain, kind of radiating leg pain, maybe even some lower back pain that you may have. So first thing we do is we put it on the ground. We go ahead and come down. We're going to sit on top of it. So if I'm going to roll my right hip out, I'm going to bend my right knee and put my right ankle on my left knee like this. You have to support yourself with your arms, and you're going to lean to the right side so that most of my weight is on that hip. I'm going to start at the bottom where I feel the boniest part of my butt, and then I'm going to slowly roll up towards the top of my hip when I hit another bone. If I lean a little bit to the side, one way or the other, I may access kind of more sensitive areas, and the more tender an area is, it typically means that that's a problem area, and you need to spend some time slowly rolling back and forth over top of it. I always like to tell people, think of lumpy dough. You're trying to roll that dough nice and smooth so that the tissues can glide past each other and the pain will start to decrease, and you'll start to get increased mobility in the hip. Now it is uncomfortable, so when you're doing this, if it kind of hurts or is really uncomfortable, that's normal. Just as long as you don't have any shooting, searing pain, that means you're like pressing on a nerve or numbness tingling down the leg, that you want to avoid. But if it's just tender and uncomfortable, it's only going to be that way while you're on there. Once you get off of it, you'll be fine. So I keep rolling. I spend about 2 minutes kind of rolling from one end to the next, and then I roll back. Notice I'm going nice and slow. When I find a spot that's really tender, I can do an active release. I keep my knee bent, I can drop my knee to the ground and lift up. I do that 4 times, and then I continue rolling. Now, the more frequently I do this, the less uncomfortable it will feel, and the looser my hip and my lower back will feel. So keep this in your living room. Do this constantly every day, and you'll notice that a lot of your pain and discomfort will start to ease up. And you only need to spend about anywhere from 2 to 5 minutes doing this. And obviously, as you start to feel better, you're going to want to do more and more. So that's my tip of the day, and I hope it helps you.